Hi, this is Darlene Hutton with QRS Educational Services. In this video, we will be discussing the role of continuous waveform capnography, which has become standard guideline therapy for the 2010 Heart and Stroke Foundation protocol of airway management with an advanced airway. We have the endotracheal tube in the patient. For hospitals that are equipped with continuous waveform capnography, this is just one of the devices that's out there on the market, and there's a picture of what the waveform is going to produce once this is all hooked up. With the endotracheal tube, I take the one piece, and you can see there's only one way to connect this. Okay, doesn't fit like that. There is your computer section in here that picks up the amount of CO2 being exhaled. This part will then be inserted into your computer module or your crash cart module. What you're going to see then on your waveform analysis should be a reading between 35 and 45 for your end-tidal CO2. That's the amount of end-tidal CO2 or carbon dioxide being exhaled in a patient who has a spontaneous circulation. Now, should this patient suddenly become pulseless, what you will see on your end-tidal CO2 is a value of 0. Okay, so you assess your patient, you do your CAB assessment, circulation, airway, breathing, and if the patient has no pulse, that is associated with an analysis of 0. There is no carbon dioxide being exhaled because the patient not only is not breathing, but they have no pulse. So you start CPR. What you will see on your waveform capnography as you are doing compressions is you should have an end-tidal CO2 greater than 10. So you're going to see a waveform analysis here that is above 10. The guidelines recommend that we should be doing CPR for no longer than 2 minutes because we do become ineffective in that compression depth of 2 inches and the rate of at least 100 compressions per minute. And you can see on the bottom part of this waveform capnography that whoever was doing compressions during this time was becoming tired. Somebody took over and the compression, or the CO2 number increased to greater than 10. The last part at the bottom of the chart shows the patient who has ROSC, or return of spontaneous circulation. So that is an indication in which we can stop doing CPR, do a pulse check, and then manage the patient's airway and breathing. All right, so I hope you've enjoyed that video. Thank you.